Did you know that going to the dentist could actually save your life? Stay tuned to learn how with our special guest, Cris Duval.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
Dr. Crystal here, and with Dr. Mike, another episode of Live Foreverish, talking about going to the dentist and how it saves your life. You know that many people just put off their dental appointments.
No, I know no one that does that.
No one.
I've never missed my biannual cleaning. I have missed my.
You have missed?
Oh yeah.
And then you have people on the other end of the spectrum. Me.
You.
I go every 3 months.
Of course you do.
Yeah, 4 times a year.
Yeah.
Because I don't floss like I'm supposed to. So
Yeah.
I figure I would make up for it.
Yeah.
So we have someone, a guest here, Cris Duval. She is a registered dental hygienist. As a registered dental hygienist and patient health advocate and wellness coach, she has spent more than 4 decades in patient care. She founded the LifeGuard Approach, and she has been recognized for her contributions to science and patient-centered dental hygiene. She sits on the advisory board of Oral Cancer Cause, Dental Entrepreneur Women, and the Children's Airway First Foundation. Cris, thank you for joining us on our show.
Thank you so much. It's great to be here.
So, the first question we want to know is, give us more information about the LifeGuard Approach.
Well, after so many years of taking care of patients, 28 years to be exact, I burned out, quit my job, said, I've had it, I'm out of here. And then I remembered something that happened to me when I was 14 years old. And I was a competitive swimmer, and I was very good at what I did. I swam a race one day, and it was at my home pool, by the way. I leaned against the wall after I had finished, and I blew a great big bubble. I swam that race with 4 pieces of double bubble tucked underneath my tongue. And fortunately for me, it was at my home pool, and so the lifeguard that was overseeing the competition and the timer in my lane happened to be a physician. And they both knew me very well. They were in relationship with me. And when I started to exit the pool area, they both stopped me. And they asked me if I wanted to live to be an adult. And they said if I had aspirated that gum during the race, they would have not known what to do to try and help me.
Okay, when you say you're talking about real gum was in your mouth.
4 pieces of double bubble gum.
I remember double bubble gum.
Okay, thank you for clarifying that, Dr. Mike, because I was confused as well, and I'm not a big swimmer, so I was trying to figure out a bubble. Was it an air bubble? Was it a bubble of water that she was holding under her tongue?
Listen, just so you know, in years past, double bubble gum was real popular because you could blow the biggest bubbles with them. Remember that, Cris?
Exactly.
So that's why she had it. She was a kid and she loved double bubble.
Okay.
Well, I wanted to win races and I wanted to blow the biggest bubbles. So anyway, that was So the thing that struck me and what I've always remembered about this during my life is because it was at my home pool and they were in relationship with me. They were overseeing a pool of patients and they stayed true to what their commitment was, and that was to save lives. And so they had to say something to me. And they could have just let me walk out of the pool area and gone, stupid girl. That's going to catch up with her one day. So I have remembered that my whole life, and that is what I have anchored my patient care around, is I have the opportunity, because I'm in relationship with my patients, that I can help guard and guide their health and wellness. And if I see them doing something stupid, or if they have risk factors in their lives, I can talk about any of those because I'm in a relationship. My goal is to help mitigate those risk factors that they have in their life and to help save their life. So that's my approach. And that's why I have named my approach the LifeGuard Approach. So it's very personal.
At the end of the day, it sounds it's a personalized approach to taking care of people, because in the 80s and 90s, not only dental code, but medical care in general became much more like a conveyor belt. The HMOs were coming out. Doctors were seeing people real fast. Like there was a loss of really knowing the person.
I agree. And what I find is, yes, I agree that your dental hygienists, they sort of are the lifeguards in our lives. We see them more than we see our primary care physician, because that's just typically a once a year experience for maybe 15 minutes. The dental hygienist, you're kind of in this vulnerable space, and depending on if they need to do a deep cleaning, you're there and you're having conversations with them on a personal level, at least my dental hygienist, and you talk and you really they talk to you mostly.
You can't say anything.
And so, yes, I can definitely see the personal connection that the dental hygienist will have with their patients.
Yeah. So, Cris, tell us, okay, so we started this by saying, well, Dr. Crystal started by saying this, a dental hygienist can save your life, getting dental care. What do you mean by that? What's going on in the oral cavity that could be so detrimental to the rest of my body?
Well, your mouth is the gateway to the rest of your body and the health of it. And so we now know that there are a bunch of pathogens, oral bacteria, that literally influence the health and the state of the rest of your body. So these pathogens, if you have them in your mouth, they not only start the initiation of gingivitis and gum disease, periodontal disease, but they also travel to distant sites throughout your body. And so they're finding these particular pathogens in atheromas in your vascular system, in metastatic cancers, that all these pathogens are showing up there. So the goal is to identify whether or not you have some of these pathogens and then get rid of them, because they are not helping your health at all. And so that's part of my LifeGuard approach, is to test for these pathogens, and if they're there, get rid of them. We have so much more new information now and better ways to help you get healthy. You see, we always told people, all you have to do is brush and floss. Brush twice a day and floss once a day, and your mouth will be healthy. That is no longer true because of the impact of these pathogens and what they have on your general health. They're even finding these pathogens cross the blood-brain barrier. They're all over the place. And so it's critical to know if you have some of these pathogens in your mouth, and then to find an effective way to get rid of them. And who else but your dental hygienist has the opportunity to see what's going on there and make a difference in your life. She can literally save your life, because we now know that these pathogens are causal to atherosclerosis.
Yeah. It's, so Cris, I this, Dr. Crystal. I had the privilege of working with Dr. Michael West at the University of Utah. This is when I was an intern, and he was one of the first cardiologists to write a paper about the bacteria found in plaques, arterial plaques, are the same. He basically made the argument it's the source is the mouth.
Exactly.
And those bacteria in the plaque is what's driving a lot of that inflammation, the immune response in the plaque. They become soft and pudgy, and then they rupture.
Wow.
So
Yeah.
here's the critical thing. What your hygienist, for your listeners, what your hygienist should be focused on is whether or not your gums bleed, because that is how these pathogens get into our vascular system and then into distant areas of our body. They're not finding them in joints. So it just makes sense that we can no longer focus on just tartar removal or calculus removal.
Mm-hmm.
We've got to get to the source, and we got to get functional to know what's causing the periodontal disease or the gingivitis that you have in your mouth, what's causing it. And it's generally these pathogens and your body's own response, the host response to those pathogens. Some people can have these pathogens and show no clinical evidence of it, but others, literally, their body just kind of goes berserk. They're at high risk when they get some of those pathogens.
So what should the dental hygienist do? I mean, but I guess the first question is, what is the standard protocol for a dental hygienist when they're seeing the bleeding, the evidence of the bleeding during the cleaning? And so what should they be? What do they typically do? And then what should they do whenever they see this?
That's a great question. Typically, they say, you need to brush and floss more.
Mm-hmm.
And that's why they ask the question, when you sit down, they'll say, are you brushing and flossing? Well, that is a question for the past. Today, the question should be, tell me when your gums bleed. Because that's going to give you an indication. I mean, half the time when you ask people if they brush and floss, they're going to fib a bit to you as your hygienist. And but asking questions that are more relevant to what we now know, we literally have to get the stranglehold of traditional hygiene off from around our neck, and we need to start asking better questions that are related to what we now know and to the science of today.
So when you even when you bring up the idea of bleeding gums, Cris, okay, so what is it? Light brushing that concerns you that causes that, or does it take a little bit more of a deep clean to cause that bleeding, and then that's concerning? So how do you define bleeding gum? Like what happens? Is it light brushing, etc.?
All of the above. Healthy gums do not bleed, even at a hygiene visit.
Okay.
And so I guess that would include flossing if you're seeing blood when you floss.
Absolutely. There's a little test you can do called pink in the sink. You can put some toothpaste in your mouth, brush for a couple minutes, don't spit all the toothpaste out, then run soft pick or something through the in-between spaces, then spit it out, spit the toothpaste out. And if you see pink in the sink, your gums are bleeding, and you should be concerned.
Ooh.
There's a great website.
I didn't know it was that strict.
This, the number 3 or the 3 causes of death in this country. Number 1, heart disease. Number 2 is cancer. And number 3 is medical error. And I contend as a hygienist, if you are not doing this is a life-saving screening that you're doing if you find out that your patient's gums bleed. And if you aren't focused on that, my personal opinion is you're committing medical error. And medical error is the omission, not doing the right thing for your patient, or commission, you're doing something maybe like scraping tartar off the teeth, but you're not checking to find out what the pathogens are that are causing the bleeding. So I'm a real stickler about this. It's about life-saving screenings, and asking the question, tell me about when your gums bleed, is basically a life-saving screening.
Now, let me ask you, do you find that this is a two-way street where the health of the oral cavity, we already see that it can impact brain health, heart health. Dr. Mike mentioned, we're seeing these pathogens in plaque. But do you also find that systemic issues, systemic inflammation related to whatever, a person is dealing with, do you then see that causes the inflammation in the gums, or maybe causing a person to have more bleeding? So is that kind of what we're hearing, is that maybe because you're having this bleeding, that's a sign that maybe you're having systemic inflammation somewhere else and you need to address that?
Well, it's definitely bidirectional, but it begins in the mouth.
Mm-hmm.
There are now 57 diseases, chronic diseases, that are linked to these oral pathogens. 57.
Well,
that's a lot.
So, yeah, and we know that's heart disease.
Yeah.
You mentioned they can get into this the blood-brain barrier, so there's stuff there with cognition. There's a whole host of stuff.
Yeah.
Cancer.
So how are we testing these? What I know you mentioned kind of the identifying the different pathogens or the bacteria. What are we doing to test those and to find out what they are?
There are some tests that you can do that literally you spit into a tube and set it off to the lab, and they tell you if you have any of the pathogens in your mouth and at what level. So you can imagine if somebody has a lot of P. gingivalis, which is what is implicated in perio and Alzheimer's, you literally know what it is you're dealing with, and then you can develop a plan with your hygienist and your dentist to get rid of those. And one of the things that I do want to mention is that it is not uncommon that a lot of people are becoming antibiotic adverse. And so we have technology now and alternative ways we can get rid of and eradicate these pathogens than simply using antibiotics. There are times when antibiotics are indicated, but we generally do not like to just hand out antibiotics as the first course of treatment because of what it does to the gut microbiome. So there's lasers, there's activated oxygen or antioxidant therapy that can be used. So there's lots of things we can do about it. And one of the ways we often test a whole family, because gum disease my mom had it, gum disease runs in my family. What runs in your family are the pathogens.
Oh,
so
that's
we
interesting.
test, yes, there's 3 ways to transfer these pathogens from one another. And it's mothers, lovers, and dogs.
Oh, the dogs. So,
try to avoid, for your listeners, avoid letting your dog lick your mouth. That is the best way to transfer these pathogens from one to another.
Yeah, I think, what I'm hearing is our audience, our listening audience needs to be, me too, you too, we need to be just more proactive about this. Do the pink in the sink test. Is that what it was called? Pink in the sink?
Yes.
Yeah. Pink in the sink.
And if there's pink in there, you got to go tell your hygienist.
Yeah.
And that you want to know what those bacteria are.
Yes.
Yes, and this is so important, and I'm glad you're picking up on this because just like you were talking about medicine, you have to advocate for yourself. My goal here on being here today is to help people become aware of what's going on in their body and realize that they have to start self-advocating. They have to start asking different questions. Don't just assume, oh, I'm going to the dentist to get my teeth cleaned. The purpose of a hygiene visit, in my opinion now, is to literally perform some very important life-saving screenings. And in fact, I have a quote that I am so passionate about, because if your hygienist isn't focused on your health and wellness, and if you aren't asking her to partner with you, tell me about what I need to do to improve my health. If she is not engaging with you in that endeavor, that's medical error, in my opinion, because my quote is, overlooking or ignoring clinically based evidence for whatever reason, I don't care what your reason is, it can have a catastrophic impact on the patient's overall health and wellness and open the door for disease and even death.
Wow.
So we know we can prevent heart attacks and strokes by getting rid of these pathogens. They are a major player. And so there's a website also that your listeners can go to. It's called ZT4, the number 4, BG.com. And that has a patient portion and a clinician portion. And you can find all about it. And the ZT4BG stands for Zero Tolerance for Bleeding Gums. And that's what, as a patient, you should have zero tolerance for bleeding gum. You need to know why your gums are bleeding.
Yeah.
And if you don't get that.
On the flip side of this, Cris, what about, the cardiologist, the neurologist? They need to be asking, are your gums bleeding? Do they bleed easy? We need to bring this into the conventional side, the conventional medicine side, and have that conversation.
Yeah, absolutely. The silos between medicine, dentistry have got to come down. And cardiologists and everybody needs to be spending some time, and they need to be asking quality questions. That's the difference. Mm-hmm. A cardiologist may say and understand the importance of oral health, but they're probably still back asking questions that don't have anything to do with what the science is of today. So they should be asking their patients, tell me about when your gums bleed.
That's a good point.
Yeah.
Yep, I agree.
So a couple of things I wanted to kind of go back on and to discuss is you talked about some of the life-saving screenings. And as I was kind of looking into this topic, there was one screening that I wanted your opinion on, and it's taking blood pressure in the dental office. And there is, I guess, a movement to encourage dental hygienists. Hey, you have this patient here, take their blood pressure before you do their cleaning. So is that one of the other, I would say, life-saving screenings that you advocate dentists to perform?
Absolutely. Absolutely. There are a variety of reasons. What we know high blood pressure is caused from, and we just screen. You don't want to give anesthetic to a patient that has a blood pressure issue. Maybe they came in today and they forgot to take their blood pressure medication. These are just parts of things that you do if you are a lifeguard and you know the impact of A patient that's afraid of dental care, sitting in your chair, has high blood pressure, you just want to make sure that it's safe to treat that patient on that day. I've had to send patients home or send them to the emergency room. A couple times we've had to do that over 40 plus years of care because their blood pressure is just way too high. Excuse me, this is my therapy dog, Ginger.
Oh,
Hey,
we
Ginger.
love dogs on
Seriously.
our shows.
Yeah.
So another question that I had was I wanted your take on mouthwash because there is a new movement. And when you talk about what made me think of it is you were saying antibiotic resistance is an issue and antibiotics are really not the answer. And I kind of, in a way, look at a lot of the mouthwash as they're kind of an antiseptic in the mouth. And although they may be ridding you of some of the harmful bacteria, they're killing the good guys as well. And is there, I just want your thoughts on that. And is there a better approach that you would suggest?
Well, I'm not a big fan of mouthwashes because if your mouth is healthy, you don't have to be concerned about you having bad breath or any odors coming out of your mouth. Particularly, you do not want to use a mouthwash that has alcohol in it. That simply will mask and change the pH that's going on in your mouth, and you don't need it. If your mouth's healthy, you don't need it.
Yeah. I'm a firm believer now. There's a lot of good research. If somebody has high blood pressure, treat it or not, don't do mouthwash. It knocks out nitric oxide production pretty significantly and all this kind of stuff. So if you have high blood pressure, don't do mouthwash.
Yeah. So let's talk about the role of nutrition in the dental office. We know that there are different probiotics. There's vitamin D. There are omega-3s, calcium, or even hydroxyapatite. I think that's the name of it. The activated calcium that can
Remineralization.
sometimes be used, and if you have a small cavity, to use that to remineralize that area. What are your thoughts on those nutrients and how that fits into the LifeGuard approach?
Well, we have to give our body what it needs to function properly. And with the way farming is done today, there certainly aren't the nutrients that we are able to get in our food anymore. I mean, what we truly need. Nutrition is a big thing for me. And I think the best thing to do is do some of your testing through Life Extension and find out what your body is lacking or how it isn't able to run all the processes through your body. You might have some areas where you're congenitally missing something in your nutrition, and so you need to find out what it is and then support it. If you make it, but at a lower level of what you need, support it. And if you don't make it at all, take it. So I'm a huge fan of nutrition. So, in fact, I wanted to tell you guys, many, many years ago, I think it was in 2004 or 2003, I came upon an article because I subscribed to Life Extension magazine. And the title of the article was The Dangers of Poor Oral Health. And that is what spurred me on. You see, the first week I started a job after I got burned out and quit. I went to work for a dentist that had a very different idea of what a hygienist could be for his patients. And he essentially wanted me to paint a bigger picture in my patients' lives of who I could be for them. And so he took me to lunch the first week. Now, this isn't what he said, but this is what I heard. You know the difference?
Yes.
Unfortunately.
Yeah. So I heard him say, I want you to start a wellness program. And I thought, what have you been smoking? How can I do? I'm just a hygienist. And so I heard him say, I'll give you continuing education, the technology that you need, and I'll give you a personal coach. Let's see what you can do. And I literally took off from there. And that article in Life Extension magazine was one of the keystone pieces of information that I got that helped me shift how I was taking care of patients. And it literally helped me take the stranglehold of traditional hygiene, which is scrape and polish, chat and polish, And so I wanted to be that person that could really make a difference. And I developed how you can, instead of repairing the damage, you prepare patients for health. You see, the most important part of a hygiene visit to me are life-saving screenings.
Mm.
Very nice.
So how do you find a hygienist that has this philosophy? It sounds like this isn't taught in the normal dental hygienist program. So how can our listeners find someone? And then if not, I guess the next question is, how do we prompt our hygienist? What questions should we be asking to get our hygienist kind of going down this train of thought?
Well, I would start with the patient first. And I think that having the patient become aware of what has changed and what's different, so they're going to start asking for different things from their hygienist, who they want them to be. When I started on this, the first question I asked myself was, who am I committed to be for my patients? Am I going to be someone that's going to save their lives? Or am I just going to be a chat and polish hygienist? Mm-hmm. And so that is a critical question. Your patients can ask the hygienist, tell me who you're willing to be for me.
That's a powerful question.
Yeah.
Yes. And then the next thing, and a question that I've always asked a patient, you might as well take a 3-inch piece of duct tape and put it over my mouth if I don't know the answer to this question. And we can turn it around so that the patient can ask a question that's very similar. But the question that I always ask patients is, tell me about what you want for yourself.
Mm-hmm.
And then a patient can ask if they become aware of how things are different now and that they want something different than just a chat and polish hygienist. Interview the hygienist or ask her, hey, I want to know if you'll partner with me on helping me have optimal health. And who will you be for me? Will you be like an advocate for me? Will you coach me towards this level of health and wellness? I value that for myself, and that's what I need you to be for me. As your patient, I need that from you. So there's ways that you can turn this around, and that's why I'm focusing on having the LifeGuard approach be patient-driven. I want patients to call up their dental office and say, hey, I want health and wellness for myself, and I want to know if you guys are just as focused on helping me get that.
Wow.
I want to stay in this practice.
That's powerful words. You're listening to Live Foreverish with our guest, Cris Duval, registered dental hygienist and founder of the LifeGuard Approach. Cris, how can our listeners learn more? How can they follow you?
Well, I'm on the LifeGuard Approach is on Instagram, LinkedIn. It's on Facebook. And that's a great place. You can message me, DM me, and you can also email me. I love to get emails from people, patients.
That's good.
I'm here to help.
That's wonderful.
I
Chris.
want to help them. And one way to kind of counteract this number one disease killer, which is heart attacks and strokes, is I'd encourage you to get this book.
Healthy Heart, Healthy Brain.
Right.
All
And
right.
it's by doctors Amy Doneen and Dr. Brad Bale. And they've included in their book some suggestions of how you can take action and how you can help yourself, advocate for yourself with your dentist and hygienist. I mean, I love to be able to act as a personal coach for people. And it's merely, I work for you. How can I help you get what you want? Because I find out what their motivators are, what they consider benefits. You see, all patients want one of two things. They want to move towards the benefit of health, or they want to move away from the consequences of disease. And how your hygienist approaches you clinically, what she does should be exactly the same, but how her message varies to you is extremely different, because you gotta be motivated to do this. And so that's what your hygienist can be for you.
Great information. Cris, thanks for joining us. And listeners, we hope you enjoyed this show. It's all about how your oral health, oral hygiene impacts your overall health. Really, truly, the live forever-ish approach to health.
Oh, there you go. You tied it in.
Live
Very
forever-ish. And so if you enjoyed this episode, there are plenty of additional episodes where we talk about a broad range of information. Just head over to liveforeverish.com to find over 450 shows, Dr. Mike.
I know. Crazy.
We're pumping out information for you and covering a broad range of topics. And so while you're there, feel free to give us a comment, leave us a review. Let us know how you're enjoying Live Foreverish. If there are other topics that you would like for us to cover, if there are any other amazing guests like Cris Duval, share those names with us, and we'll see if we can get them on the show. And so while you're at liveforeverish.com, again, subscribe wherever channel you're listening to. Make sure you subscribe so that you never miss a show. And by the way, Cris Duval talked about our sponsor, Life Extension, how she found out about oral health. Yeah. Great story. It wasn't something that we anticipated or planned, but it just speaks to the dedication of information that our sponsor, Life Extension, shares with the world, free information. And they would also like to thank you for being loyal listeners to Live Foreverish with a special 10% off discount at lifeextension.com.
Podcast.
Just type in the word podcast.
Podcast.
Browse around at checkout. If you find something you like at checkout, type in the word podcast. You'll receive a 10% discount on $50 or more, plus free shipping on your entire order. Again, that is at lifeextension.com. For Live Foreverish, I'm Dr. Crystal, and that is...
Podcast. No, I'm sorry, Dr. Mike.
Thanks for listening.